Take Charge Parenting is brought to you by Kids Dental. We make kids smile.
Well, no matter what age your child may be, nothing melts a parent's heart more than a smile from that adorable child of yours. But keeping that smile healthy and making sure that everything's going okay in there, there are many products and gadgets on the shelf. So Dr. Jeffrey Holt is a pediatric dentist and founder of Kids Dental, and he's here to help us kind of sift through the products. Welcome back.
Thank you.
There are a ton of products, and I think you went shopping and your office went shopping, and this is just
We had a lot of fun.
a little array of things. So let's start right off the bat with toothbrushes.
Well, as you can see, there are a huge array of toothbrushes for children. This can become an overwhelming task for parents when they're on the toothbrush aisle shopping for a new toothbrush for their child.
So what should they be looking for?
Well, I think there's hundreds of different toothbrushes available, so I think they all, pretty much do about the same job. So I think the thing to narrow down the choice is to first, for the parent, to look at the labeling and determine the age group that their child's toothbrush would be in.
Well, that's really interesting because when I looked at this, for instance, this Pro Health is for 4 months to 24-month-olds. I had never noticed that. Maybe it's because I don't have a 4-month-old. But nonetheless, it's clearly labeled for you.
And this is because the size of the head and the toothbrush configuration, the bristle configuration, is appropriate for the teeth that are in the mouth at that age group, for that age group. For a younger age group like that, some of this is just going to be massaging the gums and brushing the first few teeth that come in. But secondly, let the child choose the brush that they want, because this is going to make it more fun, and they're going to brush longer, and
they're going to spend more time in the sink.
Yes, and that's what we need.
Okay, these are cool. I think this is what you're alluding to, the spinner kind of brushes. Are these good?
Yes, they're great. I think probably do a better job than a manual toothbrush, just because they're spinning around and there's some mechanical action on the tooth. There's lots of fun characters, and some that play songs, some that time the child for 2 minutes, others that light up and blink. My favorite is this Sonicare for kids here. This is an ultrasonic toothbrush, and it pulses at about 32,000 strokes per minute. So this is amazing that, there's a parent or a child cannot brush that quickly. So
well, how much does something like that cost?
Probably in the $39, $42 range. So it's a little bit more expensive,
but a good investment in your child's overall oral health.
Right.
Okay, now let's talk about toothpaste. Because there's also, I think there are as many toothpaste as there are toothbrushes out there.
Exactly, and again, a lot of it comes down to which character the kid wants, which will make it more fun for brushing. But the biggest question parents have is, when should I transition to fluoride toothpaste? So it's very important to use a training toothpaste such as these with no fluoride until about age 2, 2.5, really until the child can spit on their own. Only use about the size of a lentil bean, just a very small pea size. And this toothpaste is for training the child to spit, not to swallow. So that way you can transition to the fluoride toothpaste as soon as the child is able to expectorate the toothpaste.
So let's talk a little bit about kids and braces, because there's a lot of kids at younger ages are getting braces. And I think it's difficult to brush your teeth. I was a brace wearer, and I think it was difficult to brush your teeth. So what kind of products do you recommend?
Well, it's very difficult to motivate a teenager to brush and floss their teeth. But it's very important during orthodontic years because teenagers are 5 times more prone to cavities with all these wires and brackets in their mouth. So one thing that I think every teenager with braces should have are these 2 products. The Sonicare toothbrush, which we just looked at for the kids. You can see, I'll put this in a glass of water and you can see how the pulsing action makes a huge difference. So you can see how that would wipe out all the gunk and plaque between the teeth.
And that's timed, isn't that? I mean, there's a period of time that it tells you you're done.
Quad pacer, so it tells you to brush one quad, then move to the next.
Okay.
For a total of about 2 minutes. And then this is one of the latest and greatest inventions. It's called the Air Flosser by the same company, and very difficult to floss around these wires and brackets. So this pumps a blast of air and water between the teeth and around the wires. You can
Wow, that's stricken.
it
Again,
makes a
what's kind of the price range of that? Because again, you're making an investment in your child's mouth.
These run probably around $69.
Okay.
So, but if you watch how this works, it
Yeah.
blasts this air and water between
Okay,
the teeth.
so I
it makes
know-
a huge difference.
I know parents love to talk about, we love to give them information that they could take away to help their children. So we have a great infographic for you. A healthy smile really starts with a soft toothbrush. You said a soft one.
Yes, all bristles the family's bristles should be soft, and never buy a toothbrush with anything more than a soft bristle, because this can cause damage to the enamel of the teeth and can also cause the gums to recede.
We know the recommendation is every 6 months to see the dentist. However, if your child has braces, a little
More
longer.
often, that's right. Yes.
And
About
then
every 4 months.
just
is a
real
good
quick,
idea.
I love the teeth whitening because a lot of kids want their teeth whitened.
We get
You
lots
say
of
no,
questions
no.
from teenagers and parents about bleaching. Bleaching should never be done before age 12. We have a lot of professional products. I think the in-home bleaching is great for any teenager over age 12, but not professional bleaching in the office.
Well,
Too harsh.
It is kind of harsh on their mouths, and
That's right,
they're
yeah.
still young yet, and they're still developing.
That's
Well,
right.
we've been talking to Dr. Jeffrey Holt, a pediatric dentist and founder of Kids Dental. There are 2 locations, one on the Dallas Tollway in Plano and one on Hebron Parkway and in Carrollton. And you can find out more information at ktxdtv.com. Dawn, what's coming up next?
Well, we'll wrap up today's show with advice every parent can use, no matter what age or stage your child is in. Come on back.
Need some parenting advice? Send us your question. info@kidsdr.com.